only on The Expert. Yaroslav Holovenko, the Chief Technical Officer of 3D Metal Tech, provides metal 3D printing technology for the surgery of humans and pets. Good afternoon, everybody. Nice to see you on my The Expert channel. Yaroslav is with me.
Hello, everyone.
Tell me, because it's really interesting what you are doing, tell me what are the benefits with the technology which you are working with?
So we are working with metal 3D printing, and our company called 3D Metal Tech, and we are producing patient-specific implants from titanium. We are metal 3D printing, and the benefits of this technology, it's allowed to produce complex geometries, and also if you're talking specifically about medical application, it allows to produce larger structures. I have some examples in my hands right now. So this is like hip joint implant component. And you can see that it's covered with such a lattice structures which are not possible to produce by any other production method. And the benefits of these structures is they are better for bone tissue to ingrow. And let's say such first 3D printed implant like that was produced and installed only in 2008, like 2008. Yeah. So it was like 15 years ago. So it is very beneficial for medical, for clinical performance of the patients, and any other technology cannot produce such stuff. Only 3D printing. And also this technology allows to produce, like make a pre-operational planning, basically when surgeon can create a virtual copy of bones or even plastic copy of bones, and see the exact how the defect, for example, looks like in reality, not only from like CT scans or some X-ray images, because all these methods are some interpretation, let's say. But if you have some part, like for example mandibular in your hand, you can estimate what is exactly happening there. So it's much easier and much more beneficial for surgeon.
As I understand, you are preparing the specific 3D printing for the patient, for the specific patient.
Yeah, basically this is one more benefit, because everything which we produce, we can produce in only one piece, and it can be specifically for that patient, for his specific defect. It will not suit to any other patient with any other defect, because it will perfectly fit only this patient. And 3D printing allows to do so. It doesn't require any specific additional equipment or tools what is needed for traditional. A 3D model, and you can make it in 1, 2, 3 after the model is finalized.
Okay, but the first you have to prepare this according to the patient, to the shape of his body, as I understand.
Yes, exactly. That's how it works.
Yeah, how looks like all process? What is the beginning to the end?
So first of all, we receive CT scans from the doctor, and based on these CT scans, it has some layer thickness. CT scan has some layer thickness. Based on this CT scans, we create 3D model of the we call it anatomical 3D model. Basically, for example, like this one right here. So we can see the school, and we can see also the defects. For example, like this one didn't have it. It has some fragmented bones, and also it didn't have part of jaw, etc. So based on that, then we create, or let's say connect with surgeon via Zoom or maybe face-to-face meeting. It depends, and we can discuss what he is expecting to fix first, because if it's such complex, for example, cases as this one, it is not possible to fix it in one surgery. It should be step by step. So we are discussing. He is telling what is the clinical plan of the operation, of the approach. Then we create a 3D model, agree with the surgeon. We also can print some, for example, plastic prototypes like that to check, to show the surgeon before the real 3D printing of the real part. Like this is titanium part, and this is just plastic one for preliminary check. And after surgeon confirms the final design, he tells, okay, this is exactly what I wanted, or he can also tell, okay, I need some extra places, for example, for some screws, or let's say in this case some muscle fixation, etc. We can edit and then print the final design from titanium.
As I understand, you are using the same data, the same 3D data for both printings.
What do you mean?
Because you are working with some kind of data to make the 3D printing in plastic, and then you are using exactly the same data, just only updated this data to print in 3D with by using titanium. Is right?
Yeah, exactly. So basically, this is we use CT data to create anatomical model and implant model. We know the requirements, or let's say the limitation and possibilities of our machine, our specific machine, and that's why we are also using SLA printing, because it's very precise. It's almost the same precise as my metal 3D printing. So we use it to make a prototype, to estimate the design, and because what is the purpose of this step is just to make sure that everything is fine, and make sure it in a cheaper, let's say cheaper approach, because plastic, if something is wrong, we can see it on the plastic, and it will be much cheaper. Then we printed it from titanium, and then see, okay, we have to change something.
Yeah, of course, because the material cost is different.
Just to optimize the step. But yeah, this is the thing. The plastic model and the metal one is exactly the same. So
can you show us what kind of softwares are you using?
So we are using Materialize, Mimix, Rematic, Materialize, Magix for Mimix, and Rematic is for design. Also, we are using, for example, we are working not only for medical, like regular medical cases. We are also working for veterinary medicine.
Okay.
And in this case, the tasks there are a little bit different. And for these cases, we are using some free software such as Blender, or if I remember correctly, it calls 3D Slicer for CT scan segmentation, etc. So it's a bunch of different software, but yeah, I will show you. And for working with the machine, which is behind myself, we are using materialized magics, but I guess it's quite common for almost all the machines around the world right now.
Yeah, of course. Yeah, this is just a lot of softwares to use. Okay, could you move with us all process from the beginning to the end to show us exactly how it's doing, how it looks like the process?
Can you repeat, please?
Can you hear me? Hello?
Yeah.
Okay. Maybe you got for us some example to show us how the process of your work looks like.
Yeah. So I will also probably send you some parts of the video after we talk, but I will let's stop maybe in let's take this cranial plate as an example.
Okay.
So first of all, we receive CT scan data, and as I already told, we create this model of the skull.
Okay.
And it has a defect, and you can see it right now on 3D model. 3D model, and after that, our bioengineer is creating the model of the implant.
Sorry. As I can see, the most important is the preparation of for this example the bones shapes, the specific shapes of the bones around.
Yeah, so basically, if you're talking about cranial plates, there is usually two options. One option is symmetrical mirroring, and the second option is when software creates this surface based on the curves of the skull itself. Both options has pros and cons. So basically, usually bioengineer is and doctor is the ones who is deciding what is the best, because, for example, sometimes you also have to take into account how much soft tissues is here to cover this implant, etc., etc. And all this information comes from the surgeon, and then so basically it could be a little bit slightly different from case to case. But this is two main approaches which can be used for creation of the cranial plates.
For this example, I've got some questions. The first question is, I can see some small holes, really a lot of small holes. What is the reason for the holes?
You mean like here?
Yes,
or
like you.
Structure?
Yeah, the structure.
Yeah, so basically these holes are created there for drainage, because if the liquid should be going fluently, and otherwise behind the plate there is a risk to appear
the bubbles of air.
Not the bubbles of air, but the like tight blood.
Okay.
I forgot the word actually in English. Like
maybe you can check in Google Translator.
It's probably hematome or something like that. Yeah, it's otherwise it will be a risk of hematoma.
Okay.
Like behind the plate. Yeah. So if there is not enough drainage and there is such a risk. So this is the purpose. Also, the purpose of these holes, like these tricky holes here, it's for temporalis muscle fixation. So basically, a surgeon can sew to this and fix to the plate.
What about the weight? The weight is similar like the bone weight, or is any differences between the left and right side of the skull?
Very interesting question. Actually, I'm not sure I can answer exactly to it, but I assume that if you're talking about this plate, this specific plate, the weight will be quite similar to the original bone weight. Yeah, because yes, the density of titanium is like around 0.5 gram per centimeter cubic. So the plate is much thinner than the bone thickness around like from 5 to 8 meters could be. Yeah, different people has a little different thickness, but yeah. So I would say it is
approximately similar,
but approximately the same.
Okay.
After the model is created, it's we are printing it from plastic to check.
Yeah,
but once the model is
I cannot understand the beginning, because as I can understand, the beginning is the bone shape. You have to prepare the bone shape to add the implant. And I think so the most important is the good scan quality to have good data for preparation of the skull in this example.
Yeah, exactly. We have requirements for the CT scan resolution and all the CT scan adjustments. Basically, it should the layer thickness of the CT scan should be less than 1 millimeter. So if it's like 0.625, if I remember correctly, it is good resolution for the CT scan.
Okay. Okay, tell us more.
Yeah, so after we confirm the design with plastic prototype, then we prepare this 3D model for metal 3D printing. By the way, the machine was just started, and it's like green light is there.
Yeah.
So first of all, we have to locate the model in the proper way and prepare the supports for printing.
The supports are titanium as well, or different kind of material?
No, the supports are titanium as well, and they will be removed after the 3D printing is done. Basically, we are printing. Usually we have this build platform in the machine, and we put a few different implants in one plate. For example, like it can be a cranial implant with regular cup, whatever, some maxillofacial implants. So we fit a few implants on one substrate, on one platform, and if we are doing it in software, it's like virtual platform. Then we slice it also in the software and send to the machine. And after that, we start the machine and let's say in approximately like from 15 to 24 or 36 hours, it gets printed and ready.
Okay, and then you are doing the machining process on it to finalize the shape, to remove everything what is unnecessary.
Yeah, basically after printing we put it in, we put all the platform in the furnace and doing heat treatment. So why do we need the heat treatment? Because there is two options, actually, two reasons actually. First of all, it's geometry. We have to make sure that after the printing, the geometry of the parts will be the one which is required. And because of during the printing we have a lot of thermal stresses because of high heating and cooling rates. there is a risk that if we do not do heat treatment, the shape of the part will be distorted a little bit.
Okay.
So this is the first reason. And the second reason is mechanical properties, because also the thermal stresses after the printing process, changes the properties of the material a little bit. And so basically by doing the next step as a heat treatment, we achieve both these goals at once. And after the heat treatment, we cut the parts off from the platform, remove the supports, and doing some mechanical treatment.
Yeah, I can understand some threads or things like that. Yeah, it's clear.
Yeah.
Okay. And then surgery or some other step between?
Between production and surgery itself, there is two more steps, like cleaning and sterilization. Usually our products are sterilized by hospital, like steam sterilization in the hospital before the surgery itself. But there is also option of radio sterilization, like X-ray sterilization. So both options can be used.
Okay. Now I think so. I understand the whole process. Do we have any differences between the human and the pets usage of the technology?
The approach is pretty similar. Actually, it's almost the same. The only thing is that pets' anatomy is different from human one, and some angles are different and stuff like that. For example, we can see it from this example, because this is a patient-specific implant for small dog, which makes two let's say aims at once. First of all, it's bone correction, deformity correction of the bone by plate, and also because the bone was deformed, the knee block was weared out, and it's also a knee block replacement. So the thing is, it's only such problem is only let's say popular for some specific dogs.
It just depends of the breed of the dog.
Yeah, exactly. And how it works in this case, for example, what is different is that there is a guide, surgical guide, for example, like this one. It's similar. Actually, it's very similar case. Probably it's the same breed of the dog, because here is the same approach, like plate and knee block, but it's separate. The dog are a little bit bigger, and it is possible to make it separately. You can see that the sizes are
I can see
different. Yeah. So during surgery, they are using, for example, such surgical navigators to cut the bones like in the exact angle and in the exact position, and the same for the knee part. And after that, for example, these parts of the navigator is just removed. They're broken out, and then you can put the bone in the correct position, and by using the same pins which are holding the navigator, you just install the plate in exactly the same holes using the same pins, and then replacing them with screws. So after the surgery, the bone is located in the correct position and the wearing of the joint doesn't happen anymore. So
Okay.
this is
as I understand, the positions of the screws and things like that is not exactly your knowledge, is more like consultation with the doctor.
In this case, actually, it's it is definitely it is consultation of the doctor, but we already have all this knowledge. It's like it's common knowledge from anatomy in veterinary. It is let's say this information is publicly available. There is some standard. As I already told, like different grades of dogs, for example, have different problems, and these problems are usually similar. And
Okay.
they are well studied, and there is an information, even in scientific publications, how to, what are the approaches, what are the correct angles, etc., etc. And we already have like database of for each dog, let's say, for each grade of what approaches can be used and what angles, what are correct angles, etc., etc. But of course, we are every time we do our part of job and agree it with the surgeon, because maybe in this specific case it could be some like more specific clinical conditions, whatever. So he can make his adjustment anytime, because it's his patient and he knows better what additionally this patient needs from us, let's say.
Yeah, it's quite clear. It's quite clear. Thank you very much for this discussion, for this meeting. I think so. It's really unique knowledge for everybody. Nice to see you here on my channel.
Thank you very much for inviting. I appreciate that.
Thank you everybody for attention, and please have a look for my different movies. The rest is in Polish, but I'm trying to add subtitles in English as quick as it is possible. Okay, thank you very much for you and for everybody for attention.
Yeah. Bye everyone.
Bye everyone.